Hi, I'm Ruth, physiotherapist at Complete Pilates. Now, you've heard me speak before about Pilates for men and all the benefits that you can get from doing Pilates as guys. This vlog is all about pelvic floor exercises for men. So a lot of men think that they don't have a pelvic floor. So when we think about pelvic floor exercises, we always think about women and probably women who've had babies. But actually, men have pelvic floors too, and sometimes can get problems associated with weakness of their pelvic floor. So what is it? Your pelvic floor is a sling of muscles, and it's a group of muscles that sits underneath your pelvis. So your pelvis is like a ring of bone with a hole underneath, and your pelvic floor muscles hold everything inside. So they are there to support your internal organs, your bladder and your bowel, and they connect to the bony bits of your pelvis. So like I say, they support your bladder and bowel. They help you with continence of your bladder and bowel. They work with your deep core muscle system. So your deep abdominals, your deep spinal muscles, and your diaphragm to give you really good foundation of core control for your strength around your pelvis and your spine and your hips. And they also have a role in erectile function and sexual function. So what kind of symptoms might you get if you have weakness of your pelvic floor? Well, because they support your bladder and bowel, you might notice leaking of urine or problems controlling wind or controlling your bowel. You might get different forms of continence, so you might incontinence rather. So you might find that if you cough or sneeze or laugh, you leak a bit of urine, so that's stress incontinence. You might find that you are going to the toilet more frequently than you normally would. Or you might find that you get urge incontinence, where you suddenly feel like you've got to desperately get to the toilet. And those can all be associated with problems with your pelvic floor muscles. You might notice problems with achieving erection and with premature ejaculation as well, which can also be associated with problems with your pelvic floor. So what can cause these problems? Well, number one is surgery. So if you have had prostate surgery or any kind of surgery to your bladder or bowel or anything abdominal, there is a risk of problems with bladder control, and it's quite commonly found after prostate surgery. And usually for most men, that will get better within about 12 weeks. But for some people, it will be a bit more difficult, and you will need to do some specific pelvic floor exercises to help. And doing those early on is really important, and knowing exactly what to do, which we will get onto. So what other things can cause it? Well, constipation can, because you're straining and pushing to go to the toilet. That puts a lot of pressure on your pelvic floor. And when we're thinking about putting pressure on the pelvic floor, you can also include repetitive heavy lifting and carrying, or maybe doing lots of heavy weights, because again, the straining and the tension that you put on your pelvic floor can cause problems with weakness. And also being overweight. And again, that's kind of for the same reason, in that you're just putting more load on your pelvic floor. So it's going to struggle with its normal function under that increased load. So what can you do? Well, it's really important to know that not all men will have the same issues. So some people will struggle with a hypertonic pelvic floor. So that's where actually it's contracting all the time and you're struggling to kind of let it go and then contract effectively. And some people will have hypotonic, which means that actually it's weak and it's not contracting enough to give you that control. So we need those muscles to be able to contract really effectively and to let go and relax really effectively. Just like any other muscle in our body, we need it to work through its full range, through its full excursion. That's what we're looking for with your pelvic floor muscles as well. So how can you check that they're working? Oftentimes, and with men particularly, but women as well, they'll kind of go, well, God, I have no idea whether I'm contracting my pelvic floor. And that's because it's on the inside. So it's obvious if you're contracting your bicep, you can see it and touch it and feel it. But when it's on the inside of you, it's much harder to do that. But there are some things you can try that will tell you if you're contracting that muscle. So you can try stopping the flow of urine midstream. So if you're having a wee, just see if you can stop the flow. If you can, feel what that's like, because those are your pelvic floor muscles. Don't exercise it like that because it's not good for your bladder to be constantly stopping and starting the flow of urine. The other thing you can do as a man is actually, without any clothes on, have a look in the mirror. And when you contract your pelvic floor muscles, you should feel and see some lifting of your scrotum and kind of pulling in of your penis. So you're going to see a change in the position of those. So in terms of actually exercising it, you want to be doing that in a comfortable position. It might be sitting, it might be standing, it might be lying to start with. And you want to work it in two different ways. So I've detailed these in the article. Firstly, it's working that endurance so that you can hold those muscles all day, every day, and keep that control, keep that support, keep that muscular support around your pelvis. So that's going to be trying to do a longer contraction. So hold it. Can you hold it for 10 seconds? If you can't, see how many seconds you can hold it for and see if you can build up to 10. And then can you do that 10 times in a row? And then the other way is doing quick switching on and switching off. So holding it for a second, strong as you can, and then letting it go fully. And that's going to give you that quick control that you need when you cough or laugh or sneeze and you've got to control your bladder at the same time. Like with any muscle training, it needs to be progressive and you need to relate it to function. So those are the basics to get you going. But as you progress, and depending on your goals, you're going to need to work those muscles in all positions and all functions. You know, are they working when you're running, squatting, going up and down stairs? And that's where sometimes it can be really helpful to see a pelvic health physio who can guide you on exactly what level you need to be working at for your goals. So here are my kind of top useful tips to think about for your pelvic floor exercises for men. Make sure that you're generally exercising. Being fit and healthy and active helps your pelvic floor. So getting in your 150 minutes a week of general exercise and some strength training, which could be Pilates, which would be great to help with your pelvic floor, is going to be good. Make sure you're eating healthily and drinking plenty of fluids. And one of the big reasons for that in this area is that you want to reduce constipation. So getting in plenty of fibre, fruit and veg, and drinking plenty of water so that you're not getting constipated and straining and putting stress on your pelvic floor. Maintain a healthy weight. So if you know you're a little bit overweight for your height, speak to a dietitian, speak to your GP, see if you can maintain a healthier weight. It's going to put less pressure on your pelvic floor. If you are getting any of the symptoms that we've talked about, make sure you seek help from your doctor or pelvic health physiotherapist. Let them know, because there are things you can do to help. You don't have to live with it. So do tell your doctor. Equally, if you've got a persistent cough, if you've got a respiratory condition like asthma that makes you cough, go and see your GP, see if there's anything that can be done, because long-term coughing can put too much pressure on your pelvic floor. The last thing I'd like to mention is stress management. If we're very stressed and we get tense, our pelvic floor gets tense as well. And that can affect its function. Again, if it can't let go and then contract, it's not going to be functioning so well. And there's a brilliant fact that I got from Claire Pacey from her podcast on this subject, the Complete Health podcast, in that if you're watching a scary movie, your pelvic floor actually contracts. So it's amazing. It works with the tension of your whole body and your emotional stress as well. So if we are stressed, it's going to affect our pelvic floor. So are you getting enough sleep? Do you need to look at being overwhelmed? What's your schedule like? Can you do something to help manage your stress levels and relax? So I hope you found that useful. If you've got any questions, any queries, do get in touch with us here at Complete Pilates. And if we can't help, we will put you in touch with a pelvic health physio specialist who can.